reform does need to happen, and you would imagine that this public health crisis would sharpen the minds in the highest echelons in government, not just in the United States, but in many countries in the developed world. What exactly needs to be done, and is there the political will to do it?
Well, it's a very good question, but it's different in each country because I think the deficiencies are different in each country. We have a chapter at the end where we compare countries. A lot of countries are going to be facing major problems with long-term care and what to do about that. Only 2 countries really have solid long-term care financing solutions. That's the Netherlands and Germany. A lot of countries, they're sort of ad hoc. I do think that coming out of this crisis, Taiwan and its health card and the ability to have real-time, near real-time data on what people are using in the healthcare system, merging that health information with travel information through the immigration and custom databases that Taiwan have allowed them to identify people who are at high risk of having COVID, get them tested, get physicians to recognize people with respiratory symptoms who didn't have flu. So I think that's actually a innovation that a lot of countries are going to look at because it really allowed them to rapidly get control of the virus. And, they've had a major success, fewer than 500 cases and 7 deaths in a situation that could have been a major disaster given their proximity to China, the trade links, the flight links, etc. So I think reform is going to depend on which country you're looking at. In the United States, we need simplification, we need universal coverage, and we need more emphasis on primary care.
Absolutely. And who fits the bill, Dr. Emanuel?
What do you mean?
Because who fits the bill? Because ultimately, isn't it going to mean higher taxes?
Well, it may be higher taxes, but it's not higher costs. The main thing in the United States is we're spending way too much money, nearly 18% of GDP, and we need to bring it down. There are multiple avenues to bring those costs down, and I think what we need to do is, rather than to look at increasing costs, we need to redistribute what we're spending. One of the things that COVID has made clear is that we're overpaying for what are called elective procedures, things like hip replacements, knee replacements, back surgery, way overpaying for that. And we should reduce those costs and raise costs for more necessary care. And I think rebalancing what we pay, rethinking what services actually are at the top of the list is important in the United States, and also looking at the prices we pay, especially prices in private insurance, need to be rebalanced. And so I think those will be major issues for reform once we come out of COVID-19.